Welcome to John's Tarot. Thank you. Thank you very much. I hope you're all having a great day out there. Another short video today. And this one is again on threshold map integration. These concepts I'm talking about, I didn't just make these up either. They came out in the shamanic tradition. Also, Joseph Campbell used to talk about them when he would talk about the call to adventure. That's the threshold. And he would talk about trials and guidance. That's the map. And then finally, return with the boon. So after that, I talked about that in my last episode where we talked about COVID. We return with the boon, or return with a method of treatment and a process to help us work through the difficult situation. So these things have appeared in my life, and I'm just sharing them with you, and how they turn up in my life and how I respond to them. The other week, I had a patient. He was an aged patient, and he was Jehovah's Witness, and he had looks like he had some type of we'll call it a cancer. And of course, he wanted to be treated in certain ways that accorded with his lifelong tradition and his spiritual tradition. And I talked to him. This was the threshold. So every day I show up for work in the ICU. I'm entering into the threshold, and this was the challenge I was handed that day. I understood. And I talked to the patient and I said, look, I understand that you have been committed to these ideals and these principles throughout your life. And I'm going to help you uphold them throughout this experience. And he was very appreciative that I would approach the situation in that way. So that was the threshold I entered into. And that was the map had to do with their specific desires for treatment in regards to any hospitalization. Now, Jehovah's Witnesses do not believe in any type of blood transfusions, blood products, or anything like that. So I had to be very careful, especially with this disease process. Normally would require those types of things. So anytime I would give him a medication or a drug, I'm explaining to him exactly what I'm doing, why I'm doing this, and how he is clear from any risk of violating his principles. What also happened during that period of time is we get liaisons from the Jehovah's Witness, and they would approach me, and they had a big list of things and a list of suggestions, and I told them that, okay, I will honor those things, and I would include them in information regarding treatment decisions and ways we're going forward with treatment. The patient eventually had to have a bone marrow biopsy for his particular problem. And we did the bone marrow, and he agreed to that. And the liaisons agreed to that. And they did the bone marrow biopsy. Now, the problem with integration. So they did the biopsy, they obtained the sample, but there was a period of waiting. There was a period of uncertainty. And this is where I am again using Wu Wei. Their family is very uncomfortable. They did the biopsy, but they want immediate answers and an immediate path to resolution for this problem. But they had just obtained a biopsy, so it's going to take a little while to get that type of information for them. And they were very uncomfortable sitting with that, and I could recognize that. And I knew exactly where we're at. We're in that period of uncertainty. And can you sit with uncertainty while the answer appears? Again, Wu Wei. And what I did to put some integration into that, was I said, okay, there was constant questions and constant uncertainty, and I understand. So what I did was I said, okay, this is what we'll do. Why don't we set up a meeting with for tomorrow with the oncologist, the family, your Jehovah's Witness liaison, and the treatment team and the social worker, and so that you could all sit down and form a treatment plan for your loved one. And it didn't exactly solve the problem, but it helped address a plan, integrating a plan to get them through that period of uncertainty. Of course, I don't know what happened. The next day, I wasn't there. I did help set up the plan. I put in an order for a social worker to set up a meeting with the family, the oncologist. I gave the number to the Jehovah's Witness liaison team that they should enter the treatment conversation. And I assume they had the meeting the next day or within a day or two after my leaving. And that was how I integrated the same concept of threshold map integration. Where are my cards? Let's move over to the tarot and see. So, in regards to that Jehovah's Witness story, and it's a very challenging treatment. And I really, it was very nice people and very not, and a very difficult situation. And as a nurse, it is my job to help facilitate appropriate treatment and respectful treatment. And that is what I tried to do. So, how did I integrate threshold map integration into that situation, to the Jehovah's Witness situation on treatment? I remember once I had a nurse there who was a Jehovah's Witness, and she says, well, and there was an issue regarding blood transfusions, and she says, well, I can't do that. I'm a Jehovah's Witness. And I tried to explain to her, I go, this is not about you. This is about the patient's wishes. But she couldn't do it. She just couldn't do it. She was working on the ICU, and she didn't last very long because it just conflicted with her beliefs. And I'm okay with that. But that's how that goes. And that's how when I talked to that nurse, I said, well, this isn't about, like I said, this is not about your wishes. This is about the wishes of the patient. And how many times have I had to take that same path, that I may not agree with some of the things the family is choosing to do as far as treatment of this patient, but it's not my decision. It is my job to do the best nursing I could do possible for the patient and for that family, and help them follow their wishes. But in that Jehovah's Witness situation, how did I implement threshold, map, and integration? And the tarot just gives us another way to look at this. Cut the deck. My ability to read tarot is a gift. It's an expression of divine love, and I'm here to share it with you in that same spirit. So how did I implement it? The first card is the Knight of Pentacles. The Knight of Pentacles, you see a guy, he's a warrior. That's me. I'm a warrior. And he's not really sitting on a war horse. He's sitting on a plow horse. And he's going to implement a plan. His plan, he's looking at planting a field that's right in front of him, and that's what he's looking at doing. And then that's me. I'm the warrior. I'm sitting on the plow horse of knowledge, experience, and spiritual growth and spiritual integrity. And I'm going to help implement a plan of some type. That's the threshold that I'm crossing. That's the position I was put in, the position of John the warrior, the COVID warrior, and now to something a little different. That's going to have to be handled a little bit more gently. And then the map, that was very true. We have the Seven of Wands, and Seven of Wands, you see competition. You see a man holding a wand, and there's several wands pointing at him, and there was several competing points of view that needed to be addressed in terms of the map. And that's what I did. And as I addressed each competing point of view, the oncologist, the family, the patient, the Jehovah's Witness liaisons, and they were all competing, and that's me standing there trying to deal with. You see the guy with the wand, and all those wands pointing. That's me again, trying to deal with each one of those competing interests in order to reach the best outcome for this particular patient. And like I said, he was a terribly nice guy, and the family was terribly nice, and you just wanted to do something that was appropriate. And as far as integration, the hangman. So the hangman, as far as integration, I was the liaison between science and healthcare, hanging between that and the wishes certain spiritual and philosophical wishes of a patient. And I was hanging in the middle. And I was that liaison between those two interests of the medical care, family concerns. I was in the middle and kind of sacrificing um, um, maybe my personal views in order to help the patient. But that has to do, and I learned a lot from that situation. The hangman has to do with learning. It has to do with uh, Odin, the Norse god, sacrificing an eye in order to learn the runes. And I'm not using runes this week. I'm just using tarot. And that's I sacrificed my own self-interest. I really didn't have any self-interest in order to carry out the wishes of the patient, in order to find a method of integration so that they can be all right. Well, thanks for joining me today. I hope you all have a good day. I hope you enjoy my little tarot readings. Be careful. So this week, today anyway, be careful, be cool, be kind, and I will see you in my next tarot reading. Okay, bye bye.